Globally, millions of people still lack access to health care, and in Nigeria, it is no different.
The World Health Organization believes that bringing out issues that affect global health will lead to an improvement and boost in economies around the world. But millions of people still do not have access to basic health care. Although progress is being made in countries in some regions of the World Health Organization's #1 goal is universal health coverage. What matters to the World Health Organization Nigerian team at this work to commemorate World Health Day is that there is health for all.
Commemoration or World Health Day shines a spotlight on the advantages of universal health coverage can bring to all people and in all places, and also why it is needed so much. It is needed because it ensures that everyone, no matter who they are, no matter where they live, no matter where they need it, can access essential quality health services without facing financial hardship.
Only recently, President Muhammadu Buhari declared his worry over the increasing rate of medical tourism by Nigerians, which contributes to the country's loss of 400 billion naira on an annual basis. The president said that his administration is targeting 10,000 functional primary health care centers. For the Nigerian government, it is all about support and collaboration to get to the universal health coverage target.
We face a near collapse of the health system. The primary system collapsed. Everybody will walk into National Hospital to UCH, to Lutz and ABU teaching hospital for headache, fever and diarrhea. And that shouldn't be so. And so what we've done is let us make sure we reorganize the healthcare system. Put more emphasis on primary care to handle common things. Fever, pregnancy, all the related things, vaccine, family planning, can be done at primary care center. And we are putting emphasis on this.
The World Health Organization believes that countries which invest in universal health care will make a sound investment in their human capital.
Balance of major public health events, there are way over 100 in 2018, means that there can be no health security without universal health coverage, and no universal health coverage without health security.
Globally, the World Health Organization is committed to getting 1 billion more people to benefit from quality healthcare services and financial security by the year 2023. Kemi Balogun, TVC News, Abuja.
Joining me now from Abuja is Dr. Ejike Oji. He's the Chairman, Association for Advancement of Family Planning. Dr. Oji, good morning. It's good to have you join me. When it comes to primary health care, we had gotten it right before in the days of late Professor Luke Ransom Kuti when he was Minister of Health. Primary health care was the center point of things at that time. I wonder how we got it wrong, but how challenging are the issues of access to primary health care right now?
Yes, it's very challenging because most of the primary health care sites or centers in the country are all dilapidated. They lack basic facilities, they lack human capital, I would say, who are supposed to be able to offer services. But in all of this, it's not really that we do not have them, but the problem is that in some cases, I'll give you a simple example. In my political ward, there are 4 primary health care centers. One of them has been there for more than 50 years. A new one was built by the community with support from the World Bank. Another one was built with the support from EU. And the 4th one was built with support from another organization. Out of these 4, only 3 are working. One of them was actually locked. It's not functional now. But the ones that are functional, only one of them has a doctor, which is built by the community. But if you look at the rate of use of those primary healthcare centers, you wonder why were they built. People are not really making use of them except one, that women go there to have their deliveries. But if you go there, most often than not, they lack the basic necessities that you need to see in a primary healthcare center.
All right, Dr. Oji, your community, Dr. Oji, your community is lucky to have the World Bank and EU sponsor primary health care and all of that. But let's look at the broader perspective. The plan to have universal coverage by 2030, how realistic is that?
Well, until we start take the baby steps in Nigeria, I know the federal government said they want to revamp 10,000 primary health care facilities across the country. Until that is done, having healthcare by 2030 will be a mirage. If we do not do that and properly fund them, I'm glad that the National Health Act, that the basic healthcare provision fund will soon be made available, because that will mobilize at least 45% of 1% of our consolidated revenue to the primary healthcare centers directly. If that is done consistently. Yeah.
Dr. Oji, before I let you go, it's a good thing there's a plan to revitalize about 10,000 primary health care centers across the country. But we know that originally these are supposed to be the responsibility of local governments. If the federal government is doing this and the local governments are not having input into it, how lasting, how sustainable would this be?
It will not be sustainable until we focus on the sub-national level. The problem we have is that the local governments are not getting the money. Most of the governors are taking away their resources because of the joint accounts. Until there is a legislative act that will separate the money that goes to the local government and the one that goes to the states. Most of the states, the local governments are not getting their money directly, so they don't have the resources to fund adequately those primary health care centers. That's why we welcome the intervention coming from the federal government.
All right, Dr. Ejike Orji, thank you very much for talking to us on TVC Breakfast.